The Personal Attendant Coalition of Texas, or PACT, held a public distribution of medical supplies it raised. Bags of 4 reusable masks and 32-ounce hand sanitizer were offered to community attendants and others. Community attendants in Texas work in the homes of 179,000 elderly and people with disabilities to keep them living in their communities and out of nursing homes, where COVID-19 has run rampant. 2 out of every 5 COVID deaths happen there, killing at least 160,000 Americans. Their responsibilities are great, but their base pay, set by the legislature, is generally lower than food service workers. PACT member Cathy Cranston was shocked by the demand for supplies.
I would say close to 525 bags of PPE. Each bag contained 4 reusable masks with a 32-ounce container of hand sanitizer. So we were able to cover, and I'm thinking of that 525, I think probably 400 of those bags went to community attendants, because we ended up outreaching to some home care agencies within the Austin, the Travis County area, and I think it was about 4 or 5 agencies came forward. And so one of the agencies, my gosh, we ended up dispersing almost 300 bags, for their attendants, 300 attendants in one agency. And so that just kind of gives you an idea. And there are smaller agencies, of course, that might have like 50, but still, that's a lot of attendants that are going, that are not getting their needs met. And yes, ultimately the home care agency is supposed to be supplying that, but the way our state is, they're pretty conservative, and so the reimbursement rates, that's just a whole nother issue that goes on with our state. Our state doesn't want to really truly put the dollars that are needed to provide what's necessary to have a really strong workforce, or provider base. So
right.
We have a strong contingency out there in El Paso, and the home care attendants, they're telling us that they're not getting sufficient amount of masks. The agencies are just giving them minimal to where they might have to use maybe 2 sets of gloves for 3 days or more, and they might have more than one client, so they're having to reuse gloves, and that's just not, you just can't do that when you're dealing with a virus like COVID and then not sufficient amount of mask as well. You don't want to reuse the same mask going from one client to the next.
Cranston says PACT has had many, many discussions with all stakeholders, including Texas Health and Human Services Executive Commissioner Cecily Young, Deputy Executive Commissioner Stephanie Stevens, managed care organizations, and the Texas Association for Home Care and Hospice that represents a majority of healthcare agencies. Their promises of supplies have not been met.
I think it's just bureaucratic red tape, really, to be honest with you, because it shouldn't take our state HHS, 10 months, 11 months into the pandemic to figure out how to distribute proper, sufficient PPE to community attendants that work for people under Medicaid. It just should not take that long, especially with the pandemic and all. We need people to advocate for this population of workers. We've kind of been left out, really. I know during I guess it was early summer, in the first CARES Act package that came down, Texas got billions of dollars, and a significant amount of the CARES Act package ended up going to the nursing facilities, as it should have. But unfortunately, what Governor Abbott forgot to include were who? The community attendants. He left out this population of workers out of that first round of money. And so we started a campaign in May, for a PPE campaign for gloves and masks. And, we went to all of the key decision makers like Governor Abbott that could send us money for that. Nothing was done. We were requesting some of those dollars go into PPE directly for our community attendants, as well as vaccinations for us, because we're considered part of that 1A group. We're essential workers that work. We're home care workers, but that hasn't happened either. And so, like I said, I think we're kind of the forgotten workforce. And it's not right. It's pretty unjust. If you're interested in the PPE issue and community attendance, reach out to your state legislator, senator or representative, and tell them how important it is to you that we have a strong workforce and that we have a protected community attendant workforce, and they need PPEs also, so that the people they work for are kept safe as well as them.
Right,
and
you
also,
are essential workers after all.
Absolutely, we sure are.
For the People's News, this is John Moeller reporting.